Afro Health Bridge Series, Uvula Cutting, Belubelu, and the Throat Surgery Tradition. Episode 2, Public Health Risks and the Path Towards Safer Healthcare. Although traditional uvulectomy has deep cultural roots in many African societies, medical research has shown that the procedure can carry serious health risks, especially when performed outside a medical setting. Traditional uvulectomy is often carried out without anesthesia, sterile instruments, or proper medical training. As a result, children undergoing the procedure may experience complications such as severe bleeding, infections, breathing problems, or damage to surrounding tissues. A systematic review of traditional uvulectomy practices in Ethiopia found that the procedure can lead to serious complications, including hemorrhage, septic infections, and airway obstruction, as documented by Getachew and colleagues in 2024. In some cases, children have required emergency medical care after undergoing traditional uvulectomy because of uncontrolled bleeding or infections caused by unsterilized instruments. Research in Nigeria has also documented the continued practice of traditional uvulectomy among young children. In a study conducted in Jigawa State, parents reported that the procedure was often performed to treat cough, vomiting, or throat problems in children under 5. However, many of these symptoms are actually caused by common childhood illnesses, such as respiratory infections, which can be safely treated in hospitals or clinics. Another important concern is that traditional beliefs about illness can delay medical treatment. When families believe that a disease is caused by spiritual factors or by the uvula itself, they may seek help from traditional practitioners first. Researchers studying health beliefs in Rwanda found that cultural explanations for illness sometimes create barriers to accessing modern healthcare, leading families to rely on traditional procedures such as uvulectomy instead of seeking established medical treatment. From a public health perspective, this delay in seeking medical care can increase the risk of complications and reduce the chances of early treatment. However, public health experts also emphasize that addressing harmful practices requires respectful community education rather than condemnation of traditions. Many communities trust traditional healers because they are familiar, accessible, and part of local cultural systems. Public health programs therefore work best when they engage community leaders, parents, and traditional practitioners in conversations about safety. By combining cultural understanding with medical education, communities can gradually reduce harmful practices while still respecting cultural identity. The goal is not to reject culture, but to ensure that children and families receive the safest and most effective care possible. At Afro Health Bridge, our mission is to bridge the gap between African cultural health traditions and modern medical science to protect health and save lives.